I have Darral Campbell with me in the studio. Darral is the manager of Dementia Canterbury. Just been having a very interesting chat with Darral off air. Let's put Darral on here. Good morning, Darral.
Good morning, John. Morena. It's lovely to be here on World Alzheimer's Day.
It is indeed. Morena to you too. And it is World Alzheimer's Day. Tell us quickly a little bit about yourself, Darral. Dementia Canterbury, that's a big area, and I think you're also covering the West Coast, aren't you?
We do. So Dementia Canterbury is a not-for-profit organisation that works extensively in our community to support people who are living with dementia and the people that support them, their care partners, their family, their whānau. And we cover a very big geography all the way up to Kaikoura and the West Coast and down to Ashburton, across to the peninsula, and of course North Canterbury where we are today.
Exactly. And how many people are working with Dementia Canterbury?
We have a team of about 17 to 18 people travelling throughout the region. Most of our services are based in Christchurch, but we do deliver services in all of those other areas, be it intermittently. We have workers based, as I said, on the West Coast and in Kaikoura who are delivering services there, and somebody who travels through to the Ashburton region, somebody who travels up here to North Canterbury, and a lot of services that are also based in the city.
Yep. And how many people are under your care in Canterbury?
Currently we have around 2,500 clients. We usually get over 600 new referrals every year, and the current estimates are that there are around sort of 7,000 to 7,500 people likely to be living with dementia in our Canterbury West Coast community. They may not all be diagnosed.
Right, I see what you're saying, yeah. And what's your background, Darral? I mean, did you always have an interest in this field?
I have always had an interest in this field. My background is social work. I'm a social worker by trade and have spent most of my career working in the health field, be it in hospital environments or university environments, and really in the last 10 years have moved into the community. Wouldn't be anywhere else. It's a fantastic place to be working, great opportunity to really make a difference.
Darral, there's dementia and then there's Alzheimer's. The two completely different things, or are they sort of related?
John, that's probably one of the most common questions we get asked. Dementia is the umbrella term for a whole range of conditions. Alzheimer's is the most common and the one that affects more people. It affects something like 50 to 70% of people with dementia have Alzheimer's type dementia. But there are other dementias, specifically things like vascular dementia, which is increasing, Lewy body dementia, temporal lobe dementia, and increasingly we're seeing a lot of younger people with younger onset dementia. So they're people that range in age from around 40 to 65. Wouldn't normally be looking for them to have dementia, but they do, and they have a very different experience because of their age.
Okay, it's a very, very complex thing, obviously.
Indeed.
But as you say, it appears that people are, coming down with Alzheimer's or dementia at a younger age. Any reason for that, do you think? Does lifestyle play a part in it?
We really don't know a lot. What we do know is that the things that are likely to be protective factors are the things that we know are good for our heart. So we often say what's good for our heart is good for our head. Mm-hmm. Things like a Mediterranean diet, regular exercise, getting good sleep, managing depression, staying active mentally, continuing to learn into our latter years, really stimulating the brain. All of those sorts of factors are factors that we're not sure. We think that they are protective to some extent. That doesn't guarantee that if you do all that you won't get dementia, but certainly it tends to suggest that you'll be healthier and therefore may be less likely to develop dementia.
Okay. On a personal level, my godmother was a very active, sporty, very bright woman, but she had this fear all her life of Alzheimer's because there seemed to be a history of it in the family. And sure enough, sadly, she did contract. I'm not sure if contract is the right word, but she came down with Alzheimer's. Do genetics play a part?
They can do, but the part is small. So it's not likely that a lot of people will develop dementia because they've got a family history or a genetic propensity. But there are a small number of dementias that are linked to a genetic inheritance. What is more likely is that because we've got an ageing population, the chance of developing dementia dementia increases with age. So as our population ages, we're seeing more people living longer, perhaps being treated for other things, and then going on to develop dementia.
Okay. Interesting you mentioned the Mediterranean diet. Would alcohol, marijuana, for instance, recreational drugs have any bearing, do you think?
There's certainly a very a clear link between excessive alcohol use and dementia, and that's one of the types of dementia that people may be diagnosed with if they've had a long and sustained history of alcohol abuse.
Mm-hmm.
Jury's out on marijuana. I haven't seen any evidence around the connection or the if excessive smoking will cause. But we certainly know that smoking in general is something that affects our vascular system and therefore may increase our risk of developing dementia.
Okay, so whether it be tobacco or dope, it's not good. So for anyone listening now, heading into the danger zone age-wise perhaps, what should we look for that may indicate, perhaps we need to get a checkup?
The thing that people most commonly know about dementia is around memory impairment, and that is certainly one of the most common and first obvious sort of symptoms that may be the result of dementia. May not be either, so it's always worth going and getting that checked. But there are other symptoms that we should also look for, and sometimes look for in combination with memory loss. So that's perhaps language difficulties, forgetting words, forgetting names, forgetting things that people know really well, or having difficulty finding the right name. Motor activities, coordination, doing up buttons, tying laces, concentrating, planning, organising. Sometimes we call it kind of, putting the dots together to make the line. People that have been able to do that relatively effortlessly, maybe noticing some changes and some difficulties in doing that, and recognising and identifying objects, as I mentioned before. So you might know that I want to find that, but I'm not sure that hat is a hat. So if people do experience symptoms and they do have cause for concern, or most importantly their families or people who know them well have cause for concern, we'd really encourage them to go and talk to the GP. The GPs have a fantastic pathway called the cognitive impairment pathway, and that's a tool that they use to help make a diagnosis. And a diagnosis is not something done lightly. It is a good, thorough piece of work that needs to happen before you could say someone has dementia.
Mm-hmm. I would imagine it would be rather frightening, because if you're delivered that news, you're of sound mind. In other words, this is something that's going to get worse. So do you play a role in supporting people who've been diagnosed?
Absolutely, absolutely. So that's a key part of our role at Dementia Canterbury, and we are at great pains to point out that there is good life to be had with a diagnosis of dementia. For many people, a diagnosis is a relief because they've known that something's not right. So once they know that they've got dementia, then they can start to make some decisions around their life and what they want to do. And we really work hard with our community to provide opportunities for people with dementia to continue to do the things that they've always done, to continue the things that interest them, to continue to be able to give back to their community, to continue to participate. We say now that probably the most important treatment for dementia is the social prescription, and that's to remain socially active, to remain socially connected, and to remain socially stimulated. But unfortunately, they're the very things that people often stop doing when they get dementia because they're embarrassed, or they are perhaps being protected by their families, or they feel that they won't perform in the way that they used to. Mm-hmm. So we're really encouraging people that we can find opportunities for them to participate in environments that really work for them.
Darral, a pleasure to meet you. Thank you so much for coming into Compass FM today, and it's great to know that you have a fantastic team of people here in Canterbury to look after us, those that may have that shocking news in their life that they are going to be suffering from Alzheimer's or dementia. I'm not sure if I'm allowed to use the word suffer, but anyway, Darral Campbell is the manager of Dementia Canterbury, everybody. It is International Alzheimer's Day today, and it's also Mental Health Awareness Week this week, and Compass FM have invited various people in to speak this week, and it's so nice to meet you. Thank you, Darral.
Thank you, John.
It is Compass FM.